Hi, I'm Carrie Chevarelli. I'm a local Austin-based physical therapist and the owner of Healing Foundations Physical Therapy. I am a breast cancer survivor, having gone through chemo, radiation, and deep flap reconstruction. I wanted to share with everyone today some alternative type treatments that I used during my cancer journey that provided me a great deal of relief. I will say that with any alternative-based treatments or modalities that you're considering using, please make sure and clear it with your doctors. Whatever it is, make sure that you've cleared it with them prior to its use. One of the treatment techniques that I found the most useful during the early stages of my treatment when I was in chemo was the use of acupuncture. The chemo created a lot of nausea as well as feelings of liver toxicity and liver congestion. And I unfortunately was not able to take some of the medications that my oncologist provided because of the side effects. So I gained permission from her to do acupuncture. And it was an amazing result. Almost immediately once the needles were placed, my nausea would go away, and it would oftentimes be gone for up to a day after treatment. I also found the acupuncture over the course of treatment to be very, very beneficial for addressing lymphatic toxicity, as well as stiffness and just general feelings of well-being. I found that the acupuncture provided a great deal of a sense of relaxation and well-being, which was really important through my cancer journey. I would advise you to make sure that you've checked with your oncologist as far as your blood counts and any associated things that might contribute to them allowing you to do acupuncture before seeking an acupuncturist. And it's also advisable to use somebody that has worked with oncology patients before. Another treatment modality that I used following radiation was the use of a cold laser. The cold laser is a relatively new modality in the healthcare arena, as many physicians and practitioners are just becoming aware of its benefits. My acupuncturist is actually a certified cold laser technician, so when I sustained second-degree burns following radiation, this was a tool that she was able to use to address my skin healing. The laser was specifically set for skin healing, and for my condition, it provided very, very quick and painless relief. And within several hours after the first treatment, I could see an improvement in my skin. I will again caution you, however, it's not applicable in all cases, and it would definitely need to be cleared by your radiation oncologist or your oncologist prior to use. But it's definitely something to consider. One of the modalities that I used during treatment with chemo was herbal compresses, specifically the use of yarrow. Yarrow is an herb that is related to chamomile and grows here in Texas. It can be purchased in a dried form from an herb shop. And we used it to make a strong tea, and then a cloth was soaked in the tea for a number of minutes and folded and then applied to my lower chest area right here where my liver is located. The purpose of the compress was actually to help with liver detoxification. The chemotherapy oftentimes hits the liver very, very hard because it's the largest filter in the body. And it's not unusual to have associated feelings of nausea and toxicity following chemo. The compress provided a lot of relief of the nausea as well as the general feelings of toxicity and liver mobility and tightness responded well to the use of the compress. The compress was applied for approximately 40 minutes, and then layered on top were hot water bottles and wool blankets. So I was wrapped in sort of a burrito type position. while the compress was on. I found it to be incredibly relaxing. I found it to be very, very beneficial for detoxification as well as addressing my nausea. It had no side effects, and my oncologist thought that it was a wonderful, wonderful treatment for me and allowed me to do it. So there are many alternative treatments and modalities out there. I found these to be the most helpful for me personally through my treatment. However, I would advise you to consult with your oncologist before you take any herbs or do any treatments that are considered on the alternative realm, to make sure that you're healthy enough and that there are no possible side effects with any of the treatments. I also would challenge you to try them and open your mind to the possibility of alternative therapies being beneficial. For many of us, we cannot take the medications, and the alternative therapies, at least for me, offered a much better option than side effects that I did not desire while I was going through treatment. Thank you for listening. I wish you the best of health.